formal introduction to Ian Hutchings of MD of Vita Safety, who's been an absolute legend for us in terms of our own health and safety. And I know a lot of people in the network that I'm in, obviously an absolute specialist at a time when it's needed. But today's obviously the white paper Future of Work Part 2, which myself, Adam Mitchinson of my2be, have obviously been working hard on. What do you see as the next sort of 3 to 6 months in the sort of battle between health and safety, if you like, in business, well-being of staff, the commute, all that sort of stuff? Because obviously you're probably bored of talking about that after the last 6 months. But where do you see that now in terms of the next 3 to 6 months?
I think I've not heard the word getting back to normal for a while. There's a realization that I just can't see anything in the short term at the moment. I forget what it was now. Say April and May, the government had quite a nice chart that sort of said, oh, this is where we're at now. This is what's going to happen. This is when restaurants are going to open. And we don't have anything like that. We don't have a roadmap at the moment. So it's hard to say it's hard to be a visionary and say, yeah, in 3 months, this is what it's going to look like, because I think so much depends on your organisation.
It's becoming apparent that, like, we've got staff who are going in now, and you could argue sometimes it's for productivity. You could argue definitely from a sociability perspective, but it is actually becoming a well-being escape for some people now to actually travel into the office, see other colleagues, all that sort of stuff. Do you think at some point they'll weave in well-being and health and safety and the whole cultural aspect of, actually, this isn't just about how your physical office or your physical commute or your home office looks, but actually how does this fit into your well-being policy? Do you think that could develop to that level?
I think it's already there to a degree. A lot of the, I guess, maybe sort of medium to larger organisations have really focused on this a lot more now. And there is guidance out there, there's HSE guidance, but I think it really needs to start to be more of a consideration, because it's risk management, isn't it? You're creating another issue, potentially much more significant if you look at it, of impacts on the NHS, impacts on social care, impacts on just the whole piece across the board. The other thing outside of mental health that I'm concerned about is clients basically forgetting about other hazards and other risks and other safety issues. It's about proportionate risk management, really. In the early days, where clients have tried to do the right thing by putting things in place in their business, and have actually potentially caused other risks. And when you've looked at it, you've said, well, actually, that's completely disproportionate to the risk. Certainly initially was this real focus on PPE. I think lots of people didn't even know what PPE meant till about 6 months ago or whatever. I wish I'd sold PPE now for the last few years. It would have been like in the south of France by now. You could equate it to panic buying and just say, let's just slow down and just think about what we're doing. And
I think the reason a lot of people bought into lockdown one, is, if you want to call it that, the initial wave that we had, was there was a plan, there was a route to an end of it. But at that time, we were thinking of what's the immediate, when do we get out of it, when does it end? But from one of the other conversations we had, it was actually with Jimmy, who's an ex-army captain, who was saying about decision planning. And they immediately started thinking 12-month plan. When it comes to health and safety planning, there was an immediate reaction for everyone to get all the relevant stickers and pieces in place so that your office was COVID compliant and hand sanitizers everywhere. But now that the office environment isn't necessarily something we're returning to, what's the focus on businesses for having safety measures in the home? It's like if someone falls over at their own kitchen table because they were working from it and they had the laptop plugged in, is that the businesses? Is that to do with the business? What's that about? So
longer term, you're going to get more stress related claims. To be able to prove someone's contracted COVID somewhere is quite difficult, really. So that's less likely unless you're working like a healthcare setting. If anyone goes to employer and says, okay, well, show us your risk assessment, you've got people working at home, have you looked at stress and well-being? It's quite a quick win for a solicitor to ask for all this information. And if you just haven't got it, that sort of bangs your rights, for want of a better word. So you can almost see this sort of, the whole have you had an accident in the last 3 years type situation. Were you working from home? Were you doing this? Were you doing X, Y, and Z? Did your employer keep in touch? And there's all these different things. So I think we need to really look at it again. And something I was just thinking about, and I've only just mentioned to my couple of people in my team, is actually just because we can still meet someone outside. Let's not have that Zoom meeting next Thursday. Let's go for a walk and just have a chat.
Couldn't agree more. I think as well, I think businesses are going to realise that they perhaps have eroded their culture afterwards. It might be okay to move to agile, but actually if they never ever meet, do you actually see the commercial impact? But then that shouldn't be the driver. I agree with you. I think the driver should be that actually people's well-being, particularly I think where it's different if a business is international and actually there's practical reasons to be agile. But if it's a cynical, well, we don't need an office anymore, COVID proved that, and we've closed our office, everybody works from home. If they've not kind of thought that through and provided any kind of cover or option, I think, you know, quite rightly there'll be claims in that situation. I mean, that one of the reasons we've kept our office open, even, you know, during lockdown, is to give people that kind of space to get away from the home working environment. In terms of your world, Mitch, obviously you're dealing with a lot of international agile businesses. Is there much chat around the transition of the last 6 months around either health and safety or well-being?
I think well-being more than anything else. A lot of these businesses were, you know, the tech businesses, they were prepared for working from home overnight in some respects, in that they had, you know, they had Zoom, they had Teams, they had Slack set up for communication at least. So working from home flexible working wasn't the big issue. It's now this, everyone's working at home. So it's the fact that everyone's doing it. So you don't just have someone out the office for a bit or someone working remotely or part of a remote team. It's the fact that everyone's doing it. And what became apparent for a lot of people was most people were only communicating with their immediate teams, their immediate subordinates, their immediate direct reports. And you're only really speaking to a handful of people regularly. You're not meeting anyone new. You're not really learning anything new because you're only dealing with everyone in your immediate. That can create even bigger pockets of isolation, because even though you're talking to people, like you're still talking to the same people. So for us, the mentoring side of it, it has a massive impact on well-being, because you're connected to someone who isn't your manager, someone you can have, you know, confidence in, and that's like a release for a lot of people. It's almost like dealing with a counsellor in some respects. A mentor can sort of double up on that without being necessarily like qualified. I think when it gets into more serious mental health, that's where it has to be referred. And yeah, that's the main thing. It's they've already had in place provisions for working remotely, but I don't think anyone was expecting to be the whole world fully remote in one go.
Yeah, exactly.
No matter what.
I think the point about mentoring is really important actually, because I've probably not given that as much thought as I should have done. And you could argue in a way sometimes in a really smaller business, in an SME, that almost becomes more important, because you might just be dealing with one or two people.
How do you put an informal structure in place when, you know, previously you might have been able to have the chat over the water cooler?
And if you're onboarded onto a business, you think about the typical experience, even a badly done experience, you'll get to meet a lot of new people quite quickly. Whereas people are joining businesses now, they've had Zoom or Teams calls, they've not really embedded themselves, and that's where we're seeing again a bit of a take up with people wanting to say, you know, they get their mentors in place, and then anyone who's onboarded into the business is immediately connected with a mentor as part of their onboarding experience.
I was going to ask, because I think Ian's got probably more experience across his client base and the world generally in terms of seeing things done well versus badly, and how the rules have kind of impacted as they've changed in a constructive way. I'm not trying to get political. Are any of the rules that sort of contradict each other? Is there anything where if you could lobby the government, you'd say, look, actually these two things collide and they don't help anybody, that you'd actually change overnight? Or any recommendations? I mean, one example to say, put you on the spot, I look at the settings that you put people in, for me, feel like they need categories rather than categorizing regions or cities and all that. It doesn't feel like it's intelligent enough. You know, the obvious one being a care home at one end of the spectrum versus a pub or restaurant at the other. You know, never the twain shall meet, obviously, in the middle of a pandemic. But those kind of things don't seem to have had the right level of attention. And okay, in the first few weeks, you'd forgive a government to not know how to act, but you sort of think November, we should surely have a bit more intelligent reaction.
I guess because I've been involved in sort of risk management for quite a long time, there seems to be a fundamental misunderstanding of risk generally. And I think an example of that is basically because you look at risk and it's effectively, it's exposure, likelihood of exposure versus the consequence of things. The tier system, unfortunately, I think seemed like quite a reasonable idea, but we're just far too late. And it's almost like if you look at hierarchy of control and risk management, the last thing in the hierarchy of control is always going to be PPE. And there's a number of different things you can do along the way to sort of reduce that exposure. So it does get a bit political, doesn't it? But you do wonder sometimes where the advice comes from. And I don't mean medical advice. I mean just general risk management.
And if you just had a unified approach, I mean, it takes the politics out of it then, doesn't it? I mean, that for me would have been the first thing to do, is to say, actually, let's just all agree that there's a one decision, one route out of this, and one program. You say one roadmap. And
just having a framework. I guess it's having a framework, isn't it? So that framework of how we're going to look at this situation, as you said, okay, it might be in it for the long haul to a degree. And I think that's how it sort of started, wasn't it? There's certain indicators. Okay, if the R number goes to this, then this kicks in, or if we get it down to that kicks in. And we just seem to have lost the path somewhere along the line.
I think people are also, as we've just shown there, we've gently tiptoed around the subject because you are worried about it being political. I don't think anybody wants it to be political. You just want to get into, as you say, the roadmap to move out of it.
I think effectively the country is at risk from something really significant. We need you need a cross-party coalition to deal with this. It's a long-term issue. It shouldn't be politicised. Anyway, I've started to go down that path now, but I think it's such an important issue.
I actually don't think it's too late for that, in the sense that as much as we look at short-term effects and trying to get things back as quickly as possible, we should also be looking at, right, okay, what is the long-term effect? I think that goes to businesses as well. I think that's a great analogy of, from a political point of view, you get everyone on side for different parties. But going back to what we said before about Jimmy and the planning they took from their military experience, was that war games planning, it was disaster planning and decision points. From
a health and safety perspective, I think getting everybody to buy into a plan is absolutely vital. But
I think some of it signposted employers as well to the right information. So there's loads of good stuff out there that, with the right guidance and the right support, will help people. It's that line between the government guidance and what employers are expected to do. And I think there's just possibly too much of a gap in between. The thing with obviously the increase in home work and agile working is obviously, when I'm a prime example this morning, I think I've been sat down for about 4 hours. It's actually really bad for your health. Really mobile. I think the term agile working is very good, because what it sort of leans towards is it means you're not sat at a computer for 8 hours a day at home. It's just a rethink about how we work, but actually building in, almost like you can't enforce exercise, but building something into the day to say, actually, we need to give people a bit more time.
In general, nobody wants to sit on Zoom for 8 hours a day.
Well, you wouldn't go. I personally, I think when I was in the real world, you basically you might have a couple of meetings in a day. I wouldn't go to back-to-back meetings all day without having a break, and it's you just wouldn't do it normally. And it's suddenly seen as, someone can find a window in your diary and we'll put a Zoom call in there or something.
That's that, in it.
Yeah, exactly. Yeah.
Going back to the first time when people weren't prepared and they were, like you said, then relying on the government to tell them what to do. From that experience of seeing who was well prepared and the things they did, from what is getting passed in the next 24 hours, do you think there's anything there that's like, that's your number one, that's what you need to fix or get in place?
When we got into this, I actually sat down and wrote a bit of a strategy, like a 1 or 2 page thing, just like an emergency plan, really, to sit down with the team and say, right, this is what we're going to do, just to try and give people some I guess, a bit of degree of comfort, even though no one knew what was happening. I think we almost need to do the same thing again. It's taking time to reflect and actually read the guidance properly, because there's so much stuff out there that I've seen that's actually factually incorrect. And so
Yeah.
I'd say don't just trust social media. Look at the actual guidance and look what it actually says. Most of the mistakes I've seen with people rushing and making assumptions about things, and getting second opinions on the guidance as well. I think one of my biggest learnings was actually looking at what's being done in other countries as well. So I sort of went out, tried to go out of my way to see what they're doing in Australia, see what they're doing in other parts of Europe, what they're doing in Ireland, because there's actually some really, really good guidance outside of the UK. So part of our sort of, I guess, that sort of proportionate decision-making process was to go, okay, this is what the UK government are doing. This is what our own risk assessment says. Oh, there's some really good stuff going on in Singapore. What are they doing?
Anything that you'd advise us, either as business owners or just for the wider network, I guess, that you think we should be thinking about?
There's going to be an increase in correlation between HR, employment law, and health and safety, which I think needs to be considered. So I think what we tend to find with small businesses is usually if the health and safety side of things isn't particularly well managed, you usually guarantee the HR side will be even worse.
Yeah.
So I would just be mindful of some of these conversations you're having. If you've got members of staff that have got particular concerns, how are you dealing with some of these things now? I think being honest. I think sometimes as well, and just saying, we've all got to pull together a bit. It's difficult, but maybe some short-term information. Okay, well, this is what we're going to do between now and December, and then we'll regroup again mid-December. Right, this is what the plan is for the next month, just so we've got some short-term, at least, vision on where things might get to. Really, lack of certainty and lack of control are two of the biggest stressors in life and in the workplace.
Control the controllables and sort of plan effectively as well as you can for the rest. But you can get on top of the things that are in your control. You'll be prepared for whatever.
Yeah, good point. Very good point. So I'm conscious of time. So thanks very much, gents, particularly for joining us.